Great. So I'm just going to talk a little bit, kind of quick overview of what Justice in Aging is doing, and then Kate is going to talk a little bit about some of our advocacy work, and Tren's going to talk about some of what she's doing that is more state-based in California. So if you don't already know us, Justice in Aging advocates for low-income older adults. We particularly try to focus on populations that have lacked legal protections in the past. So people of color, women, limited English proficient individuals, LGBTQ individuals. And we have recently, I mean, we have always done it, but we have recently made a more concerted effort to put equity at the center of our programmatic work. And we're going to be rolling out an equity initiative, but I think it's something that we've been working on more intently for the past year or so, but really thinking about how our program work is addressing some of the negative effects of systemic racism that we have seen in our country, and what our actual programmatic work can do to combat that and really purposefully make a difference in that area. So that's something that we think is very important and that we really want to work on going forward. In our economic security work, we have primarily focused on Social Security and supplemental security income. That's really kind of where our bread and butter lies right now. We do trainings, we provide written resources, case consultations to advocates, different things. But in terms of some of the work that we've been doing recently, I mean, most recently, I think the impact of the pandemic on low-income seniors' ability to apply for SSI has been really kind of at the top of our list of concerns. But generally speaking, in terms of policy, we have been looking at modernizing the SSI program and really thinking about how to pull it into modern times through some policy reforms. We have been pushing for the SSI Restoration Act for a while, which would do a few things to modernize the program, like increasing the asset limit that you heard about, that was very low, increasing the unearned income and earned income disregard so that people can keep more of the money and income that they have, getting rid of in-kind support and maintenance. So different things like that. We also support other bills that would make the Social Security program itself better for low-income older adults. So looking at like the Social Security 2100 Act or the Stop the Wait Act, which would eliminate the waiting periods for SSDI and Medicare. We do a lot of our legislative work in coalition because that's been pretty effective to have kind of a voice with other organizations. So we're part of the Consortium for Citizens with Disability, where we're on the Social Security Task Force. We're on the Strengthen Social Security Coalition. We're part of the Leadership Council on Aging organizations. And so those coalitions have been pretty helpful in advancing some of the work that we think is really important and giving us an even bigger voice to really talk to legislators and the agencies to really make some of these changes. So I'm going to turn it over to Kate to talk a little bit about some of our advocacy work with SSA, and then Trin can talk, and then we can kind of hear from you about, you know, what things you're doing and what things you think are really important in terms of building up economic security for low-income older adults.
So one of the things I do is coordinate a coalition of advocates to do administrative advocacy at the administration. And it's about a core group of about 20 or 25, mainly legal aid advocates from across the country. You know, we mostly focus on the needs of SSI applicants and recipients in our advocacy at the agency. But you know, since SSI covers the lifespan, there are, you know, some people who have more expertise around SSI for children, some people who have more expertise around disability benefits for adults, and you know, then people like me who have some expertise around SSI for older adults. But that is the primary focus, you know, kind of the voice that we bring through this coalition in our administrative advocacy. And then I will hand it, oh, and we also moderate a couple of listservs where we have a wider group of advocates from across the country who mostly share information with each other and ask questions. You know, there's no agency presence on that listserv, so it's more of kind of an internal support thing. And then I'll hand it off to Trin.
All right, so in California, we like Justice and Aging in our current name and the name we had before. We've always done a fair amount of work in California, like around the issues we work on, but really focused on how the state is interacting with those programs and kind of the connections and how those programs are playing out for residents of the state. And so I'll talk a little bit about the work we do, and I'm centering it around a couple of concepts. One is because this series of workshops is about building coalitions and what that actually means. And so we're involved with coalitions in various roles. So there's some areas where I'm the organizer, I'm doing the organizing regular calls, trying to I am the person pushing what's happening. There's other coalitions that I'm involved in where I'm a co-lead and I'm helping out. There's a core group of folks who are doing that work and pushing it forward. Other coalitions where I'm a simple participant. But I think that lessons from all of the coalitions are exactly the same. And that's for all of them in terms of what works is they're incredibly valuable. It's just like any relationship with other people. It's hard. So it's not like as with anything, it's like there's challenges, but there's some really important values for both building the advocate network and then as a result of that, building building the support that you need to actually get things to happen. I think one thing that happens oftentimes is that so there's kind of two aspects to that. One is whether and how you can cross program areas. And so I'm coming in as we do a lot of SSI. So there's a lot of income areas that are linked to that, like SNAP or even the TANF program, work programs, earned income tax credit. There's a lot of things that are around it. And so if we can, there's one thing is the extent to which we can responsibly broaden what we do so that it actually addresses programs that are connected to each other. And that's for me to understand what's happening in other programs and why they're important. But it's also the same so that other people realize we're part of the same ecosystem. And what does that ecosystem look like? So there's a cross-program aspect to it. There's also a population aspect to it, because the reality is that we're all working from the advocate perspective. You could be a homeless services provider. Maybe you're focused on food. Maybe you're focused on food for homeless folks. Maybe you're focused on kind of immigrant workers. Maybe you're focused on workers in general, or you're focused on kind of issues related to kind of the Black or Latinx community, or Asian Pacific Islander. There's kind of different areas that there's different areas that we end up focusing on in terms of who we think we're serving. And one of the kind of incredibly important aspects of doing coalition work across areas is kind of being able to have that conversation about who exactly is both that who are we serving and what's the extent to which we're actually serving the exact same population. And I think sometimes if we're not actually talking to each other, it can be easier to say, I don't know what that other person's doing. I'm doing food security in the certain aspect. But if you have to talk to each other and it is really important to, then you're like, okay, I know enough about what you're doing to say, here's my set of folks who I think I'm dealing with. Here's your set. And regardless of who those two people are, there's a really strong crossover in terms of the Venn diagram. And being able to have that conversation across different sectors and across organizations that are really focused on one population or another, it's important to be able to recognize that we're we're basically advocating for the same people. And I think it's a really important lesson, because I think it also helps everyone to come into the space from, actually, that's who we are. It's in terms of, instead of saying, and I'm still the SSI person, so I'm still kind of focused on that. That's where my expertise lies. But being able to say that, but also recognize that I'm here for a community, and the community that I'm here for is the same community that everyone else is here for. There might be some differences here and there, like the Venn diagrams don't always completely cross, but that overlap is incredibly strong. Right? The population that we're working on is incredibly strong. I think you end up building a lot of building a lot of trust among kind of sectors and subject matter areas by being able to do that. And then you also build up a base of people who are actually informed enough about the issues to know, this is how your issue connects. This is how your issue is actually my issue. And this is how we're actually serving the same population. And that, at the end of the day, that actually makes it a lot easier because at the end of the day, it's something's happening. You need to be able to figure out whether you agree or don't, whether you're supporting it or not, the level of organizing and advocacy you're going to put towards something. And both on a coalition level and on an individual level, the more informed the coalitions and the individuals are, the easier it is to move, because the coalitions have enough information to make a decision, even on things that seem fairly obscure, because everyone has a knowledge base for the issues that we're talking about. So you can do that, and everyone has a base, and everyone's actually operating from kind of the same sense of mission. So even though it's all different, and I think we also end up learning a lot from each other and making sure that the policy ideas that we're putting forward, it's a testing ground for what happens, for what kind of how good your idea is. So I think oftentimes having those cross-sector groups is really important, because I'm thinking SSI, I'm thinking seniors, but seniors are also low-wage workers. And low-wage workers are also people from across the age spectrum. And so bringing that in and understanding what that means, kind of it's both, you're able to kind of the low-wage worker universe and the senior universe are able to interact better. And then we actually have better, we just have better information. So the more we know from those different angles, the better, the more informed I am, the more informed kind of everyone else is, regardless of whether they're working with seniors or low-wage workers. So across those coalitions. So a couple of the coalitions we work with, there's one on improving so there are cuts to the state supplement to SSI in 2009 and 2010. And there's been a coalition working kind of tirelessly for years, trying to get that money back. So it's a really broad-based coalition, and we're one of the co-leads there. And that one, that's kind of one of our classic coalitions of really broad base of hunger folks, housing, homelessness folks, the faith-based, so forth, and like a really significant partnership from kind of the food security folks, because they recognize that when the state supplement dried up, everyone showed up at the doors of the food bank, because those two, the programs link in that way, they link in a really direct way. So that's a pretty broad-based coalition, and I think which includes SSI recipients, and that's been a lot of work to make sure that both SSI recipients are actually included, and then also that they are helping to guide the advocacy. I mean, I think lessons from that is just the same lesson from, it's hard to work with people, hard to work with advocates, hard to kind of bring it all together. But when you can do it, it actually is a much, you have a far better outcome. And you have an outcome that actually meets the mission that we're all trying to get to, which is kind of policy outcomes that work in a way that's equitable and yeah, it's just done in the way that we would hope that those decisions are done, with the kind of input that we hope that those decisions receive. So there's that one, and then there's the coalition on kind of the state and earned income tax credit and improving that, which included expanding the state EITC to folks who are 65 and older in 2018, which went into effect in 2019. And then we also do kind of California specific. I do an advocacy group for legal services advocates. And I think that you end up having a lot of connections in between the different groups. And that's actually, that's a really helpful thing, because some of it is that you have less information that has to be relayed from one place to another, because some of the same people are kind of being informed in different places. So, and I think that really helped in some recent advocacy in the state to kind of provide like a state stimulus payment for, and it came out of the state EITC coalition, which said, you know, like folks who are undocumented and filing with ITINs really got excluded, and they're a lot of our essential worker like there are a lot of the essential workers in the state. Like, let's push for getting some kind of stimulus to those folks, because they're really in every community-based organization. It's like, yeah, we're seeing that. this is important. We're seeing it. So it was like getting that idea through, and then adding in SSI recipients as well. Because again, you're thinking about, well, who is it who's, if we're thinking about that, who is it who's actually experiencing the worst of the kind of the expenses and costs and harms of the pandemic, and where would it be helpful? Because there's where would it be helpful to have, if the state's going to invest in something, making sure that we're protecting our low-income communities where they're suffering particular harm. So kind of that was one where it kind of crossed the coalitions from the state EITC coalition over to the coalition that was working on the state supplement to SSI. And so it's that this kind of work is really important. And kind of for me, one of the things I think about, like, this is not in any grant requirement. So I describe it in our grant reports, but one of the things I see as my job is actually bringing as many people together in as many conversations as possible, over and over, because again, that the work that actually kind of the groundwork of getting all that of things to be able to happen is making sure that people know each other, know what kind of what each other's concerns are, and being informed enough so that they can take action. And I think when you get people in rooms together over and over, often enough, like where you had a level of lack of information and sort of, I don't know if are we really aligned with these folks? The reality is that when you're there and you're talking, you're pretty well aligned. It's different, and you get a lot of different perspectives about, well, maybe I never thought about the difference between how documented and undocumented immigrants are experiencing certain issues. And so you can get a lot of really helpful kind of expansion of the knowledge base for everyone when you do that, and everyone comes to an advocacy point from a different perspective. So it's not like I can have a particular position from Justice and Aging, and there's a whole bunch of people who have very complementary positions. So even if it's not exactly the same, they're kind of talking about it from an angle that makes more sense for their community. That's actually like the best possible outcome. It's not the best possible outcome. Isn't we all say exactly the same thing? It's where we've kind of worked through an idea enough to know where we stand and to know that we actually are kind of moving down like exactly the same path in our different ways. All right, so I'll stop there.
Thanks, Trin. That's super helpful. I think that, so one of the things that we wanted to do here for folks who have just joined recently is hear from you all about what your work is about and what your kind of focus and policy priorities and things are and how you're trying to work to build economic security for low-income older adults. I think that Trin really made a great point that sometimes we think that we're not aligned or that we're doing completely different things. And in reality, knowing the people who are at the table who are having the same goal of increasing economic security and helping these low-income individuals in our communities is really helpful to everyone's work. And so to the extent that we know who we all are, and maybe some of you are already, I know some of you are, on our listservs or are part of our advocacy kind of groups, you know, what are you doing and what do you think is important? Where do you think that we should be focusing? So I'm gonna, while you're thinking about that, and then I'm gonna open the floor. I forgot to mention that we just recently added a new program area to our work, which is housing. And so just last year, we hired a staff attorney to start working primarily in California, but actually looking kind of at the national level as well. And we hope to expand this role into kind of a national level focus, looking at housing and homelessness issues that older adults are facing. And so we just recently released an issue brief about the rental burden that older adults are facing. And we're gonna continue to think about, you know, where we should be in this space and how we can contribute. But that's another place that we also are starting to focus, and we're pretty excited about that. So now I will stop talking and I'll open the floor for some other folks to just say who they are or what they do. And
Tracy, maybe you want to call on people, or do you want me to call on people for you?
If nobody, how about if no one says anything? Let's get, if there's anyone who wants to
it's
go.
helpful. It's helpful to like get people to like, how about, let me start with Conway Rangers because he unmuted.
No. Yes, I did.
That's perfect. That's a great sign.
So hi, everyone. My name is Conway Reinders. I'm a lead policy analyst at the Social Security Advisory Board. It's a bipartisan board that produces advice for Congress and the Commissioner on how to improve Social Security's programs. And my portfolio focuses on service to the public. So recently we had a paper last June, not so recent anymore, about field office closures and the impact that a single field office closure has on people applying for disability, disability insurance and SSI. So of course that's highly relevant in today's times when all the field offices are closed. So right now I'm working, looking at digital and phone and video services given our past focus on field offices and given COVID, but also looking at how SSA can use its learning agenda or operational measures to actually get evidence on access. I think a lot of times we look at quality, but specifically focusing on access is, I think, a base that isn't always looked at. You want to serve the people who are in the doors, but what about the other people? So really trying to focus on the access part. So that's kind of my focus at the moment. Thanks.
Thanks, Conway. We've definitely been thinking about the field office closures and how people are going to get the help that they need. And with this pandemic, I feel like it has definitely amplified a problem that already existed. So it wasn't that there wasn't a problem before. Now all of a sudden there's a pandemic and people can't get the help they need. But it's like this problem already existed and then it just got magnified so much by all of the closures. So it's definitely a really important problem that we need to address now, whether or not pandemic, but especially now.
Thanks.
Well, I'll go ahead and talk. I'm Rusty Toller. I think I'm the spy who came in from the cold. I worked for Social Security for 30 years. Before that, I worked at the VA. I came into Social Security in 1983 and 1984, right when Social Security, the Social Security Amendments, the Social Security Disability Reform Act I was in the disability program in the day, as many of you know. And I think we're at a very, very interesting time. I think we have an opportunity under the Biden administration to improve the internal administration of Social Security, but we need to really get with it. We need to reopen the field offices. For the last 10 years, I've been affiliated with WISER, the Women's Institute for Secure Retirement. We do a lot of work in Appalachia, in Atlanta, with low-income women. I too have also become kind of a jack of all trades. I'm a big Bruce Springsteen fan. I've done work in the housing area, I'm glad to know. And I'm a huge fan of Justice on Aging, Kate, and I think Justice on Aging is really, really a top organization. I like your NCLER. We put everything on our WISE website that Justice on Aging does. And I am a member of the Older Worker Task Force. I think we have a big opportunity. I think we really do need to focus on SSI. I have a personal story with SSI. I have a stepson who is mentally ill. He's an addict. He's been homeless, and he's been a prisoner, and he's had COVID. So I think I'm equipped to help out in the current arena now that I have turned 70 years old. So thank you for this workshop, and that's who I am. And I have joined the Strengthened Social Security Coalition, and will probably be branching out. I'm loosely affiliated with WISER. I could do what I want to do, and I'm certainly glad to be part of this workshop. So that's my background, and I think we've got to get to work at Social Security. We need to reopen the field offices. We need to focus on communities of color. We need to simplify and the SSI application process. And I think the education that we need to do with members of Congress, I think they're not aware that nearly half of SSA's administrative budget goes to the SSI program. And I think that's something that's pretty shocking that members of Congress should perhaps be better educated on and move the SSI Restoration Act. We really do need to move that. So I'll be quiet the rest of the day, and that's it. Thank you.
Thanks, Rusty. And also thanks for plugging NICLR, which I didn't in my introduction. That is our National Center on Law and Elder Rights that we administer through a grant contract with the Administration for Community Living. But there's a lot of really good stuff there from Justice and Aging, and we have other organizations, but it's really chock full of useful and good information. And yes, I should plug it more also. No one else wants to introduce themselves. The floor is open.
Hi, my name is Ken Sokol. I'm a retired engineer, but that was 20 years ago. So for the past decade, I've been a Social Security consultant to the insurance industry. But my other aspects of retirement from full-time work, I work with the Inner City Community Center. I also work with some housing programs to provide maintenance to homes in the inner city to low-income families. And also do with AARP, I do tax aid to provide tax to low-income families. And in that light, some of the things that I see is probably education. A lot of the people I deal with on the low-income side are disconnected to a lot of available services, both from something like tax aid to have their taxes prepared for free, to take advantage of home maintenance programs that are provided by different NGOs. More recently, making themselves aware of food banks that they didn't have the need for a year ago. But I think education. There's so many services, and I'm in the Kansas City area. There's so many services that are available and things that they can take advantage of that low-income families, elderly, are just not aware of. Recently talked to we were doing some work and maintenance on an individual's home, and she said, well, I haven't filed my taxes in 20 years because I don't have to pay taxes. I'm on Social Security. Well, she was not aware that as a taxpayer, a property owner, she could have had $1,000 rebate on her property tax for low-income seniors. She's missed out on that for the last 10 or 15 years, and she can only go back 3 years now that she's aware of it. But just to get the information out into that community, and I think that's one of the tasks. Maybe I can help in that area with all the people that I meet, working with a community center that deals with hundreds of families in their course of events, and education, very important.
Thanks, Ken. That's super helpful. We had been talking, Kate and I had been talking about some of the ways that government agencies have all of this information about people in terms of like their income, or like, Title II Social Security recipients who are very low income, and how, they could be harnessing this information to kind of reach people who might otherwise not know that there are services that could be available to them. And are there ways that we could convince these agencies to like work together or to do more outreach to really kind of tap into that pool of people who don't even know that there are these kind of services and benefits available to them? Because I think you're right that that's really unfortunate when there are people who aren't taking advantage of things because they just don't know they exist and that they could.
I just wanted to put another point on that, which is that during COVID, a lot of the places where people exchange information about these programs, community-based organizations, churches, barbershop, whatever, they're closed. And so people are not able to access the information, particularly if they don't have broadband or, access to the internet in the same way that other people do. So the current situation we're in is making it so much harder to even get the information out when it was already difficult to begin with.
Julia, can I put you on the spot and ask you to tell us a little bit about yourself and your work?
Sure. I'm realizing I forgot to rename. I am the director of finance at the Academy, but I worked for several years for HUD and also at a large nonprofit hospital in Baltimore City. And a lot of our work centered around figuring out how to bring healthcare into communities rather than have them come to us. And, I think that's sort of a public health tenet, right? To like go out into the communities. You're seeing some of it now with the vaccine rollout. But it just strikes me that it's for everything and all things. Like you have to meet people where they are. And it's sort of an upsetting side effect of COVID that it just makes it very tough to do these things. But I think what you guys are talking about of coordinating across silos is very helpful with that, because you might have the information, but maybe not the distribution abilities that other places have.
Well, and I'll just jump in. I just put something in the chat from someone who couldn't attend the workshop, Scheduling Conflict, member Larry Johnston, which seems super relevant to everything we're talking about. But I put his email in the chat in case anyone wants to connect with him and his work with a local organization called Capitol Hill Village. And he sent this white paper that I would be happy to send, or you please reach out to him. I told him I would share this with everyone on his behalf. I also wanted to note that yesterday I was in a workshop on the child allowance, and they were talking about how the principles for their ideal child allowance would include distribution through Social Security. And I pointed out that, there's this big problem about Social Security office closures. And they were like, no, they were not super familiar with that. But I'm like, that might be something to work on together. If you want child allowances to be distributed, maybe the advocates for older people and the advocates for children could work on this together.
Yeah, we see that a lot with various proposals, where people are like, hey, there's this whole agency that like touches the lives of most Americans. Like, let's harness that for our idea. But they're not like thinking through the administrative budget for that, right? Like, it actually costs money. Like, you need staff people. It doesn't like magically administer itself, right? So I think that that's always been sort of some of our hesitation at Justice and Aging around endorsing some of these proposals, is that they completely gloss over the administrative realities of the Social Security Administration. And, we support the proposal. We think, oh, universal family leave, like that's a great idea. And they're like, yeah, and the Social Security Administration is going to administer that. And it's like, no, they're not. Like, not until you come up with some hundreds of millions of dollars for their budget, because that's what it's going to take. And
Right.
Ignoring that is harmful. And
I think
Rusty has many things to say.
I heard that perception yesterday from those folks, and they were like, but don't they have a budget from general revenues? And I was like,
Well,
you should
yes
team
and
up with them.
but Kate's absolutely right. And I was always an outlier at Social Security, which is probably a good thing. But yes, Social Security. When I left Social Security in 2010, I guess 10,000 people followed me out the door. We were at 70. They were at 70,000 now. They're down to 60,000. But again, if you look at work simplification of Social Security, if people knew this might be an area, but I can tell you that the Social Security Administration, the good professional staff there would not be happy to administer another program under any circumstances. But when you look at the expense and horrible things that happen to people on SSI, if we can simplify that program somehow, that would make Social Security run better. And I understand the administrative capability does exist. It is really remarkable when you think about what Social Security does administer, just getting the checks out, getting the earnings records and the whole bit. And we can talk about that forever too. But that could, we really do need to reopen the Social Security offices. We really do need to get work simplification and SSI and SSDI in sync. But I think to have the Social Security Administration run the universal family care is probably going to be a stretch at this point in time.
I also have concerns about that child allowance. I think that the folks who are proposing that have, not thought about how that would intersect with other programs, right? Like, if it's not going to count as income for a family where one of the members is receiving SSI, I mean, that's what I would hope, but like that needs to be in there specifically. Like, how is that income going to be counted for SSI, for Medicaid, for SNAP, right? Like, I just feel like they're not thinking that through.
Well, so that's exactly what we're hoping to do with our campaign, is to have these forums where we can bring folks together like that and get some of these questions answered, which I think reminds me of what Trin was saying earlier. You don't all have to say the same thing, but at least you kind of know where you stand on things. and hopefully make some progress that way.
I would also just like to circle around back to what Larry, his contribution about villages. You know, this is a nationwide movement. It's very decentralized, it's very localized, but it really is, I think, a great movement in terms of allowing seniors to age in place, to stay in their communities, to say like here, it's very hyper local. You know, it's like, here's our neighborhood and here's the people who live in our neighborhood and this is what they need. You know, so like the white paper that he's shared gets to the recommendations for what the people in that neighborhood need. And so it's very specific. And I think it you know, the challenge with it is that it's very decentralized and it's super hyper local. But, you know, where it does exist, I think it can be a great thing to tap into in terms of like what we were talking earlier about education and spreading information and making sure that people know about benefits or services they might be eligible for.
This is Rusty. Let me speak to that a moment. The village to village movement is something I'm pretty familiar with. We have one here in Howard County. And it really is kind of becoming sort of an alternative to senior centers in some ways where it happens. The issue though, and you know, let's get back to the issue of the day, which is people of color, low income people. The village to village movement is really covering more of the upper to middle income white people. Let's just be clear. It's really good. We have a person, Howard County's on the national board. When we helped set it up in Howard County, we actually visited the villages in DC. The main work to be done though in aging in place really has to do with housing. It has to do with accessibility. I've been a member of the Homes for Life Coalition, very involved with accessibility for a long time. I live in a 3-story townhouse. So I'm very hypocritical. If I don't do my exercising every day, going up down the stairs, I'll have to move out. But yes, the village to village movement is very good. It is very local, but it's not touching the people we need to touch. But on the other hand, it takes pressure off of the offices on aging. And we are reaching out in Howard County to make sure that people who are not able to get the COVID vaccine, that they know about it and all that. So it is a very good thing, and it is a nationally based organization. In fact, ACL had someone meet with the National Village Board not that long ago. So that's it.
And kind of going back to that, we're looking at low income older adults of color. I think one of the things I hope we can do as we work through these conversations is also make sure that when we talk, the policy space actually doesn't have a whole ton of folks of color. And so that kind of making sure that we understand what it means to understand that perspective, understand the value, like what our values are around representation. It's a challenging because it doesn't contain a whole bunch of folks of color. There are I'm not going to describe what it is, but there's issues around making, like, how do we get to a policy space that I think it takes some work to get to that policy space that is going to really reflect the reality, like accurately reflect the reality, the needs, and the appropriate policy choices to allow older adults of color to thrive. And I think that's in the California work we've done, it's taken a lot of careful relationship building, lots of careful conversations. And I think we still have a long way to go here. And so that's, I think, when we think about this there's a, like, we're not helping, like who is we, who is they, like who are we helping? That's a really important piece of kind of building an advocacy structure that reflects an advocacy structure that we can be proud of.
So
I'm
we're
just-
at 3 o'clock. I was going to ask if folks have like 5 more minutes, or if they wanted to just like do quick introduction for people who didn't get a chance to speak, just so we know who's there. And I don't know if we're allowed to share like contact information or something like that, so we can kind of reach out to folks or talk to folks later.
I'm free.
Let's see. Go for it. Call on someone, Christy.
Sure. Well, I'm gonna put David Reamer on the spot if he's there, and then maybe Melissa and Jeffrey. I don't think we've heard from you, Samantha, Susan. Oh, there's Melissa. She popped in. Melissa, do you want to go?
Sure. Tomorrow I am
Oh, Melissa, you're cutting in and out for me.
getting my headset in. Pick up well.
Y'all hear me now? Okay, great. Yeah, I sometimes have trouble with Zoom and sound. So I was saying I am Thought Leadership Director for Financial Resilience at AARP. And I am focused on working with global companies to support multi-generational workforces, and also really looking at building wealth at the intersections of race, age, and gender. So doing that from a number of perspectives, but I'm a fairly new staff member at AARP on the Global Thought Leadership team. Just started in November, having come from Prosperity Now, where I was focused on programs that help people build wealth across the country.
Thanks. Nice to meet you, Melissa.
Yeah, you too.
How about, who else is there? How about David or Susan or Jeffrey? I know Jeffrey and Susan are both SSA.
This is David Reamer. Sorry for the very bright background. I'll turn my my screen a little bit. I joined this workshop because this is not an area I know a lot about. So I don't really have the expertise that the panelists have and the other speakers. But coming at it from a somewhat different perspective, the question that I always have about any program area that is focused on one group of people, whether it's people in a part of the country or by age or whatever the boundaries are, I'm always concerned that that picking one group to help means you're excluding other people from getting the same thing, which sometimes they need. Occasionally, they may need it more than the group you're helping. And on the other hand, there are some programs that are out there that are very, very broad in their in whom they help. So, for example, everybody gets the minimum wage or higher. Everyone in the country who's subject to being called an employee, at least, gets paid the minimum wage or higher, whether you're young or old or retired or black or white or urban or rural. That's part of why it's a popular program. Frankly, part of what makes Social Security and Medicare popular is that they have only one limit. They have an age limit and a contribution limit, but there's no means test. You don't have to fill out a complicated application form. It's very different than SSI or even SSDI, where you have to prove all kinds of things that are a problem with you in order to get very often what's inadequate help. So I guess the question I have is, what are the things that the panelists can think about or suggest that would greatly help older Americans in the ways you've been talking about, disproportionately help them, but aren't necessarily limited to seniors or to older people?
That's a really good question that I don't feel like I have the time to answer, but I would say that I think one of the benefits of doing this kind of work in coalition is that you don't have to then like think about the entire world, because sometimes there are issues. I find that sometimes you focus on a potential problem, but you're not thinking about the people that it affects. And so oftentimes we come into a space and we say, okay, this is a really good idea, but look at how it's affecting older adults and how what you're offering as a solution is not necessarily going to help a group of people that you think you might be helping. And so sometimes I think having the ability to have some of that focus is useful in getting to a place where everybody gets the help they need. I would also say, I think that we should be helping more people, and I think there should be more programs available to more people. And I think that that's something that we're reckoning with now. You know, how do we reach all of the various groups that need the help that we aren't providing? And I don't know that I have the answer for that right now, but I think that that is an issue. So now it's 3:06 and I do actually have to go. But this has been a really good conversation. And thanks to everybody who put their contact information in the chat. We really appreciate it. And I hope that we can have some more conversations. And now you have my contact info and I have yours. And so let's keep talking. And Christine, is there anything else that we should say before we hang up?
No, Samantha, sorry, I was like, oh, maybe you can, but hopefully we will get this group together again or another group together and everyone can connect and reconnect. Thank you all. We are sending an evaluation form out, so please check your email after this and let us know what you thought about the conference overall. We really appreciate the feedback, and if you can download the Economic Security Study Panel's white paper, we also appreciate feedback on that. That's it. Thank you, Tracy, Kate, Trin, Justice and Aging for hosting this workshop, and thank you all for coming.
Thanks so much. Bye, everybody. Have a good weekend.
Bye.